Welcome to Perspectives El Paso. I'm Leon Blevins of El Paso Community College Television. As you can see, I'm dressed a little different than I usually dress. I think out of 8 years of this program, this is the first time that I've worn a polo t-shirt. So welcome to the new world of Leon Blevins. Party sober. Now, why am I wearing this outfit? This is an outfit that I developed for one of my classes when I would deal with government and politics and health. And one of the issues on health is our drug use. Walked into a class one day, many years at community college, and a young man asked the question before I said anything, Mr. Blevins. I said, yes. What do you think our greatest problems are in this country? Oh, wow, what a question. I said, well, I have an easy answer for that. It's an opinion, my opinion. Two. One is the problem with discrimination in all of its forms. And two is drug abuse in all of its forms, and that involves tobacco as well as other kinds of drugs. These are our biggest problems, in my opinion, in this country. Well, today I have on this show a guest from the Tigua tribe, and this is Angel Montoya, and he asked me about being on the show to talk about Red Ribbon Month or week or celebration in the Tigua Reservation area. I said, sure, come on, let's talk about it. I like this subject. Let's talk about drugs and how do you keep young people from even starting on drugs. Angel, welcome to the show.
Thank you for having me. Thank you so much.
A wonderful banner. I asked you if you had a banner. You said, yes, this is one of the best ones I've ever had on this show. And celebrate Red Ribbon Week. Okay?
Yes.
So tell us about Red Ribbon Week.
Red Ribbon Week on the reservation. It's a wonderful event. It's a huge event. We actually start with a week of events for all the youth and the community. One of the things that we do is we try to educate the community about the dangers of drugs and alcohol, tobacco, making the community aware of what it is and why we celebrate it. So we start off with inviting other providers such as the Drug Enforcement Administration, treatment providers, health educators to come in and educate the community about drugs and alcohol, about the dangers of them, about trafficking and the dangers associated to that and the violence associated to that as well.
The question here comes up about these kind of programs. Now, when we go for this week, and I want to come down for part of your activities there. Some of it is entertainment. You're going to have dancers and singers, and I've been down there at times, get up and dance with some of the Tiguas doing the big red ribbons and so on. Wonderful events. So this is an attraction to get some of them to show up and come, right?
Correct. This is an event, we have activities throughout the week. Primarily the big event is happening on October the 22nd. That's a Saturday. And we start off about, I want to say 8 in the morning. Actually, the event starts at 10 o'clock with a parade around the reservation. And actually, it brings in about 40 providers to 45 providers from across the community of El Paso, Socorro, San Elizario, surrounding communities. And they provide information about their agencies, about the dangers of drugs and alcohol, and associated to that, we have a lot of activities for the kids. These are free activities. We have a climbing wall out there, we have jumping balloons, we have music, we have entertainment, and along with that, we have homes that open up and they sell traditional foods and jewelry and pottery that are made by Native Americans.
Now, isn't all of this very important on an ongoing basis for these young people to keep them out of mischief? You get them involved in music, you get them involved in dance, you get them involved in the cooking and preparations and all these things. Tell us about that. How important is that?
Part of building resilient skills for the youth is understanding their culture and understanding how important they are to the community, that it's okay to give back to the community as well in so many ways. So part of the activities that we do throughout the week is that we engage them with the elders or the older folks, and we have the older folks do storytelling, educate them on how to make bread, educate them on their culture, And we invite the community to also learn that, because it's important for community members to also understand their culture and their values, to be able to build resilient skills and avoid any high-risk practices. There's always a danger of somebody coming up to you and offering you things that are not good for you, and that is, youth are very vulnerable.
Oh, yes.
So we always offer options for them, and what can they do to avoid going down the path of drug use, and seeing that as the only way of having fun. How can we educate individuals to do it differently,
Right.
and do it correctly?
I want to show you another cap that I had made. Fun drugs can kill fun. Sometimes I go to class wearing that and talking about health and so on. And here lately we've had a lot on the news about women who have gotten drunk and then were raped because they didn't realize what was happening, what was going on.
Correct.
I have a colleague at community college. She was in my class back in the 1980s. I will not call her by name. But after I discussed some of these things in class one day, she came to the office and said, "Mr. Blevins, I want to tell you something." I said, "What's that?" She said, "I have a wonderful little girl, but I don't know who the father is because I was drunk so much of the time as a young adult, partying and having a good time." And I said, "Yes, and you're fortunate that you have this child, but it's unfortunate you don't have a father for her." She was a single parent at that time. And this, we've heard a lot here lately about these kind of episodes of people being vulnerable because they do drugs and don't even realize what's happening to them.
Yes.
Fun drugs can kill fun.
Yes. So true. So very true.
This one I had made, I've worn sometimes at different events. Tobacco kills. And I've had a number of shirts over the years. I would dress according to the topics I was on in my classes. Tobacco kills. Now, a lot of people are surprised that this is a much bigger killer than any other drug in our society at this time. I looked up on the internet this morning. It estimated 480,000 people a year dying from tobacco use. Another thing, I began to use the phrase, death in small doses. These don't kill you immediately. They deteriorate your health. Emphysema, heart disease, cancer, all kinds of things are happening.
Yes.
What do you do to convince young people to understand this?
One of the things that's very important to work with when working with youth, and we have that at our community, a prevention program, where we start with youth as young as 6 years of age, educating them about the dangers of smoking tobacco, drinking liquor and beer, and using illegal substances or legal substances, because we're seeing a lot more medications being abused.
Yeah.
So,
Oh, yeah.
So we try to educate the youth at 6 years of age or older, to start understanding the importance of living a different lifestyle, that it doesn't have to lead to using these types of chemicals as being the norm. And a lot of times, many children are exposed to this being a norm. And we're trying to change that perspective, that this is not the only way to have fun, that it's a very dangerous path to continue if they've ever seen it in their own families or around their community. So the key here is early intervention, and it has been successful. We've seen it be successful.
Okay.
Many youth have entered the prevention program, and now they're in college. They're in college here. They're in college at UTEP. They're in other universities. So they have pursued careers and a different lifestyle. So we've seen that prevention is a key to intervening a lot of this.
Now, you mentioned some agencies will be there providing handouts, materials.
Yes.
They also do this in the schools, right?
They do it in schools.
And do you go into schools as a mentor, or do you have people or teams that go to schools and do presentations about this?
We have that during Red Ribbon Week as well. We go into the schools. We have our prevention staff that actually go in. They do presentations where the children are going to school. These are tribal members. They go to school districts. So we go to those schools as well, and we try to not only share information with the tribal members, but to the general community about the dangers of drugs and alcohol and other alternatives that are healthier, living a healthier lifestyle. So there are presentations that are going on all the time.
You get people sometimes that got into drugs and are able to go and present and what happened and what they had to do to get out of it?
Absolutely. One of the things that we try to do during that period of time is we use mentors, people that have actually had experiences with that type of lifestyle, having an addiction, and they go back into the community and do presentations for us or with us. And they also go back into those presentations where children are at, so that children learn from a firsthand voice about the dangers of drugs and alcohol, the different adversities they go through, jails and being arrested, and all the trauma that goes along with the families. So yes, we do have mentors that actually go in and share their life stories.
Now, I assume you're not a professional in this field at this time. You're a volunteer?
No, I am a professional.
You're a
I am
professional
licensed.
in this field,
Yes.
okay.
I do have a program that I oversee, a
good.
substance abuse program for the reservation, Ysleta del Sur Pueblo. So I do have professionals that are licensed that conduct treatment services and prevention services.
I believe in the pre-show before we started taping this particular episode, you mentioned you had been in the Navy?
Yes, sir. I had been in the Navy.
Okay, and I've interviewed people with regard to drugs in the Navy, and we hear that right now there's kind of an epidemic of this, of various kinds of things that they get bored on the ships and they start doing things, and they get off the ship and want to have a good time and get into this. How did you deal with that when you were in the Navy?
One of the things that I did was I tried to stay very active in a healthy way. I exercised. I did a lot of photography. I saw a lot of my friends go down that path, and they were spending lots of money and they were having lots of trouble. So I learned from them what not to do. I was an electrician back then, so I continued my career in that area during my military time. And we toured everywhere. I was on board a destroyer. So we stopped at different locations, and I really tried to learn the different cultures there and the different foods. And that's how I learned to use options, other options or alternatives to avoid always drinking and always, or even going into the drug and alcohol scene. It was very prevalent.
Yeah, on a personal level, sometimes I share, and I'll share today, is my father was an alcoholic, led to a divorce in the family, and I ended up with a wonderful stepfather. My two sisters became alcoholics, and sometimes people would ask me, well, why did your sisters become alcoholics and you didn't? And my answer was always, well, they were more subject to peer pressure. I was more willing to be different, as you can see even now, the way I'm doing this interview. It didn't bother me to be somewhat different than others, but they wanted to conform and be a part of the crowd. Becoming a part of the crowd, they started drinking heavier and heavier and became alcoholics. And then eventually, one of my sisters and her husband, who were alcoholics, they got a lot of treatment with AA and became mentors to others and helping them to deal with their issues. The other one never really wanted to admit that she was an alcoholic or addicted to cigarettes, which a lot of times they go together.
They go together.
We're all together.
They do.
Not wanting to admit it. And so I think that ability to say, I don't have to be just like everybody else in high school or junior high or whatever. I can be me. Another thing I think was important in my thinking was I want to be in control of things. I don't want to do something in my brain and other people doing things to me. I want to be in control of things. Have you ever sensed that as a protective device?
Sure. Some of the youth that we have worked with, those are the kinds of statements that they talk about. And one of the things about youth is that they always want to fit in. They want to follow the crowd.
Right.
They want to be popular, shall we say, and that's the in crowd, they think. So sometimes it's really hard to, if you're not really sure about yourself, it's really very difficult to pull away from that. So this is where building up the individual is real important, identifying who you are. Cultural issues come into play, and this is where you reinforce a lot of that as an educator. But you also find the children or the youth that feel good about themselves. They know who they are. They are involved in sports. They are involved in many things that they want to pursue, and they do use that as a way to be different from the crowd. but usually those are the ones that tend to also shine and pursue something a little better down the future. But again, people that do pursue the in crowd can also pull out.
Right.
Can also pull out, because that is a dangerous path to continue. And you find that many youth do find that somewhere along the line they find themselves in trouble. Parents bring it up to their attention, or parents have difficulties with what they're doing, and they try to pull them out, and they do help them out. So we always hear about that as well.
We need to give you the opportunity to give a telephone number for contact or website, so if people want to volunteer or assist in a variety of ways, or they have expertise they'd like to share. So you can go ahead and give us that at this time.
Sure. They can call 915-860-6118, and we can provide them with any information they might need. If anybody needs any help, we can certainly refer anywhere. If you want to participate and volunteer during that event, we would love to have you. If you're a provider and would love to come in and set up a table and disseminate information about your agency as it relates to the topic of Red Ribbon, then we would love to help you.
Well, the internet knows everything. I went on the internet the other day after I talked to you, and again yesterday, and just typed in Antigua Indians, El Paso, Texas, Red Ribbon Week, and there it is.
There it is.
And you had sent me some pictures earlier.
Yes, sir.
And so the public can simply go there and find out more. And they ought to find out more about the Tiguas themselves. Look at this date back here, 1682.
Yes. It's a long history.
And it said that there's an area in this area of Ysleta that's probably the oldest cultivated area in the state of Texas, continually cultivated area in the state of Texas. And that's a lot of history down there. I'd love to go down and participate in activities in the reservation and San Elizario and so on.
Well, we would love to have you and have the whole committee come out for October the 22nd.
Mm-hmm. Well, I'm hoping. I've got it on my calendar, so I hope I can definitely make it.
And it's
down
free, so you can't beat it, right?
No, it can't be doing. And food, and check out some of the food that they're going to
Yes.
have there. I mean, you may have to charge a little bit for some of those. But do you charge for some of the foods or some of the vendors they set up?
The vendors do charge for the food. It's very reasonable, though. And they have an array of foods. They have some traditional food and some non-traditional food, so whatever your liking is. And we have a hayride that goes around the whole reservation, and it stops at different points. We have the culture center that's open. We have the community health center, or the health center, that's open, and most of the events are there. And then we have our daycare area where many more events are taking place as well. So the whole reservation gets really, really very busy. Traffic going through the reservation is very, very congested. So people are actually walking on the streets. It's a big event, a big festival. We anticipate having Mothers Against Drug Drivers out there. We have TxDOT out there that's possibly going to come by. And they have some go-karts that you put on goggles with different BAC levels, and you can drive these cars around and kind of feel how it is to drink under the influence of alcohol, and why not to do it.
Right. Have you been involved in previous activities down there? This is not your first Red Ribbon Week. You've had others, maybe 5, 6, 7, 8, 9 years?
Yes, we've been with Red Ribbon, or celebrating Red Ribbon, for several years now, over 15 years. And it just keeps growing. The parade keeps getting larger, people keep coming, providers keep calling, they want to come in and participate. So yes, it is growing, and it's growing very, very rapidly.
The reason I ask that is I like to ask questions, as I've done on recent programs, about success stories. I'm sure since you've been doing it this many years, you've heard some success stories from some kids that say now they're this tall and they were that tall and they heard the messages. Tell us about some of these that said we were going the wrong way, and from these programs now we're on the right track.
Some of these stories that you're mentioning, as I'm reflecting on some of these folks, they're now in college. Some are pursuing a medical degree.
Okay.
Some are pursuing engineering degrees. This one particular lady, she just got nominated for a Native American ambassador position. We're talking about a Native American organization that mentors young women and children. And she's a tribal member. She's a young lady. She has a bachelor's from college, and she's pursuing biomedical career.
Right.
But she's very active. She was in the prevention program many years back, and has basically done very, very well. There was no drug or alcohol involvement, but there were a lot of risk factors involved, and she has just pursued. She's doing very well, succeeding very well, and she's just we adore her out on the reservation. She's really a wonderful mentor for young people.
Yeah, I like to hear those kind of stories.
So that's one of many.
Yeah.
There's others that are graduating from college and pursuing positions with companies around the country, or coming back to the reservation and coming back as nurses.
Over the years, I've had a number from the reservation taking classes at Valle
Yes.
Verde campus at community college.
Yes, and it's a wonderful education out here.
Yeah.
We always hear from the students that are coming down here, because we do keep track of who's going to college and how they're doing, and if they need any support, the reservation is always available to them. So we always compliment your professors and your agency and the community of El Paso, and also El Paso Community College.
I haven't seen as many recently because they built the Mission campus down the road from us.
Yes.
So more of them tend to take some of their classes there. If they can't get what they need there, they come on up to Valle Verde, where I taught for so many years.
And we have many tribal members going to that Mission Valley campus as well. It's closer to the reservation,
Right.
so it is very accessible.
Mm-hmm. Well, I look forward to a lot of the activities that you have down there. I just can't I do so many different things in so many areas here in El Paso. And I mentioned before, I just finished a taping of a program for this Perspectives about Hispanic Heritage Month, middle of September to the middle of October. And I mentioned on that, as I mentioned on this one, that I love the diversity of El Paso. Don't you love the diversity here?
I love it. It's so different. Being in the Navy, I was exposed to many cultures and different traditions and foods, and this is one place where you see that, and it's really nice to see that people get along, and it's a wonderful community. It's a friendly community, and we certainly want to be part of that.
Well, I've taught other places where it was very homogeneous, very similar, everybody alike, everybody speaking only English, everybody very white. And come here and we have the military, we have the Old West, we have the Native Americans, we have the traditional Anglo, of course, and Mexico. So much that we have here that's kind of a hidden gem way out here in
Yes.
the tip of Texas.
Yes, and it's a city where people love it. They come and they love it and they stay. Being in the military, I always missed it. Yeah, other parts of the country are beautiful. They really are, and everywhere you have beauty. But El Paso has this special place, and people just love it.
Well, tell me just briefly before our time runs out, we have only a few more minutes, about your relationship under the total leadership of the tribe. Give us a little bit of the pyramidal view of where you fit into the tribe itself and the leadership.
Yes, I'm a program coordinator for the substance abuse program, so I run their substance abuse services. Mm-hmm. They have to do with prevention, they have to do with treatment for youth, they have to do with treatment for adults as well. And also we have a co-occurring disorder component which deals with mental health and substance abuse at the same time. So I'm a director under that. Mm-hmm. I'm under the behavioral health services, which falls under the health clinic. And so we're overseen by the health clinic as a component.
And you work in relationship to the state agencies to some extent?
We're working for tribal council.
You work for the tribal council, but you also have to realize, even though you're tribal and tribal council, you're functioning inside the state of Texas.
Yes.
And under federal authority.
From the tribe.
And other relationships, yeah.
Right. But we do have cooperative relationships with the state of Texas.
Right.
We do.
Yeah. So these are other aspects I like to look into, and how are things,
Yes,
what are these relationships
yes.
that are going on.
We do have our own governing rules
Right.
and laws that we go by.
And a lot of people don't understand that.
Yes, yes, and I understand that. And we are a sovereign nation,
Right.
So we do have our own court, and we have our own tribal police area, and we have our own services, that kind of thing. But we also work with the state of Texas, and we have relationships with them, and we have friendly relationships with the state of Texas. I know with the treatment components, we work very closely with the state of Texas, or Texas Department of State Health Services.
Sure.
And we follow their guidelines as well, because we want to be providing the best possible services for clients that come in for treatment.
Yeah, you don't want turf battles going
No.
on. You want to be able to cooperate and get things
Cooperative.
done for the public, and for
Absolutely.
especially your public. Well, I certainly have enjoyed having you here today and finding out more about the Tiguas and about the programs, especially these social service, and especially those that deal with drug issues.
Well, thank you,
Yeah.
thank you, and we hope to see you on Saturday, and we hope to see you October the 22nd, and we're inviting the community of El Paso to come in.
Yeah.
It's free. It's a wonderful event.
Well, I got to let you go.
I want to thank you very much for your time.
You're quite welcome. Angel Montoya, good to see you here.
Thank you.
And we're glad that you tuned in on Perspectives El Paso. Tune in for more interesting programs in the future. I'm Leon Blevins.